Hi, I'm Bert Van Hoof. I'm a director in Microsoft's Health Solutions Group. I want to start with saying that Missy cheated because Stuart only gave us 4 slides, so she used a few more, so I feel I can elaborate a little bit more on our story as well. But you'll find actually that while a lot of people enjoy a good fight between Microsoft and Google, that this is effectively an area where we do have a lot of synergy and are actually pushing the same buttons in many ways. So it starts with bringing healthcare into the internet age. Our vision is around improving people's health around the world and doing that through software. And here's a good view, and Missy talked about some of these things, but it visualizes it in a little different way. There's a lot of data about your health and your record already. The only problem is that it's dispersed across a lot of the facilities you interact with. Your employer has a piece, your health plan, your provider or your physician, your pharmacy, your kids at school may have some records relevant to their health, your parents who may be at a senior center. There's a lot there, but it's dispersed, it's locked out, and therefore you can't get all the benefits for it. Things get even worse once you look at it at the macroscopic level. I live in Seattle. If I were to move to Vegas or move to Florida, how do I get all those records with me? It's quite a big challenge. I'm sure some of you have gone through that exercise. And Missy highlighted the Kaiser experience, and knowing that there's a lot of data there, I just can't get it. So we took also a broader look early on at the broader consumer health spectrum. Sitting in today, a lot of people talk about chronic disease specifically and how to manage that. What you see here is an interesting diagram. On the horizontal, you see a range from illness to wellness. Wellness and prevention has come up a couple of times. And on the vertical, from acute to chronic. So you see an emerging 4 quadrants. There's a number of bubbles on there. We could draw a few hundred more probably, so these are just for illustrative purposes. But things like diabetes as an example of a chronic ailment. The flu, something that's more transitional. You manage as well as you can. You may have a provider interaction or not. On the right-hand side, you get the elite athletes or the fitness fanatics of the world. A lot of us weekend warriors aspiring to move up towards the top there, more chronically well. And towards the middle, you see a lot of events that might happen around pregnancy, for instance, where you do have a lot more interaction with the provider system. But once then you have a child, now there's things like immunizations and allergies and all those type of things to think about. So you can start overlaying this with a number of segments. On the left-hand side, you have a lot of encounter management, things around physicians, interactions, pharmacy, hospital, how to get your labs, interacting with your employer and your health plan, your benefits at work, etc. Around healthcare, very relevant in this context, things like remote monitoring, chronic condition management, etc. Around those young families, I already mentioned allergies, immunizations, etc. More towards the right, we get into the fitness space, weight loss, diet and nutrition, behavior modification, people trying to stop smoking, etc. So all of these are relevant. So we looked at it in the early days, we looked at all the similar statistics that Missy popped out earlier, but there was a quick realization that no single company can solve all of these problems. Even if you look at this diagram, as you traverse through your lifespan, you're going to hit all of those 4 quadrants. When you start thinking about it from a family perspective, your 12-year-old son or daughter who's in school sports, a lot of physical activity, has very different needs and interests than your elderly parents who may have multiple chronic ailments, multiple provider interactions, medications to keep track of, etc. And where you have worried, you may have geographic distance, etc.